there's some aftermath. All right, everyone. I think we had a good starting point. And yes, so there we go. Welcome, everyone, once again with our discussion about earthquake and everything else. I want to formally welcome you. It's Eretmis Cyber Chat. We are starting time now, 7:07. And hopefully we stay within an hour and a half. Tonight's topic is we are going to be looking at HIPAA. And I appreciate everybody's time. It's Friday night. You could have been anywhere else, but you chose to be here to share in the knowledge and also to network with the Eretmis family. And I hope everybody had a good Easter last week. We didn't meet last week because we wanted everybody to have that time off with friends and family. So we are kicking off tonight. And you are welcome. This is being brought to you by Eretmis Academy. And Eretmis Academy is a cybersecurity institute based out of New York. And I am going to be your facilitator for tonight, as usual, Dr. Emmanuel Edu. I'm a former United States Army captain. I'm the owner of Eretmis Inc., a cybersecurity consulting firm, and a QSA company, PCI QSA company based in New York also as well. And I'm a QSA myself. Together with our team, we help protect companies from bad guys, right? I'm also a former professor at University of Maryland Global Campus and CTC, and I love to talk about cybersecurity, to educate, and to share in the knowledge. Eretmis Academy, we are partners with CompTIA, and what does that mean to everybody here and the family? So if you're an authorized partner to CompTIA, they afford you 20% discount on all exam vouchers that is purchased through you. So if you're on here and you are looking to write any of the CompTIA certifications, you can contact us and we will give you that 20% discount. Now, it's only CompTIA that has this program. Other certification bodies like ISACA and ISC Square, they don't have anything like this. When they do come up with one, we will approach them and make sure we are getting all that discount for everybody else as well. Now, if you already have any of these cybersecurity certifications, every 3 years you have to renew. And as part of the renewal, you can choose to write the exam again, or you can choose to use what they call continual education points to re-certify and get your certification. So what we are doing tonight, cyber chats can be used as part of your continuous educational points for the certification renewal, right? So if you go to the website of these companies that run the certification exam, if you go to their continuous education tab, you'll be able to get all that information and use this to be able to renew your certification, right? And we have a WhatsApp group, the Eretmis. We have the Eretmis family WhatsApp group. I think we are almost like 900 and something. Kindly join if you're already not part of it. That is where we network and share a lot of cybersecurity good info. And then also everything that we do for Cyber Chat and other events, they are all posted in there as well. The link to join the group will be posted, so you'll be able to join. And then also WhatsApp has come up with what they call the WhatsApp channel. So this channel, you don't have to be in a group, but you can follow like Eretmis Cyber Chat. So anything that we post on our channel, you will see that on your WhatsApp when you go to your, I think, updates, the tab that says update. If you search Eretmis Cyber Chat, you will see us in there. You'll be able to join as well. So if you don't want to join the group, you can join the channel, because in the channel you are not necessarily in a group, right? So that is also an added on. I think it's been a while, like it's been around for a while, almost like some months now. So you can also use that to join. And then for our YouTube channel, last 2 weeks we were at 399, right? Our goal is to hit 1 million subscribers by October 2024. And currently this week we are at 592 as of this time, whilst we're having cyber chat. right? Our goal is to get the gold plaque. We have the silver already because we hit 100K. And we appreciate everybody for your support. We encourage you to continuously share our YouTube channel because we put a lot of good info on there. There are a lot of, I can't tell you how many people have reached out just to thank us because they learn a lot from Cyber Chat. Some even use what they learn from Cyber Chat to get cybersecurity jobs or to land their first cybersecurity jobs, right? And even those on the jobs, they are still coming back to learn from what we put and what we do for Cyber Chat. So kindly share to friends and families who are interested in cybersecurity. There's a lot of good information on there, and all of that is totally free. Right? So what are we going to be looking at tonight? We will first look at cyber news, and then we will jump into our topic for tonight, which is HIPAA. Right? There's a lot to talk about HIPAA. We might probably have to have a second session about HIPAA, but let's do the first session first, right? So for cyber news, any cyber news from the group before we look at what Dr. Edu has for cyber news or Cyber Chat has for cyber news. Any cyber news for this week? You can please raise your virtual hand, and then we will give you the floor. And if you have any news, anything that is newsworthy for cybersecurity, you can also share with the whole entire group. Right. So whilst we wait, I think we will just jump into Dr. Edu's cyber news. And then if you have anything else, we can, give you the floor to add that. So in the news, has anybody heard about this? What they call the pig butchering scam? Has anybody encountered it? Or do you even know what it is? Anyone? You want to give a wild guess what pig butchering might be? Pig butchering scam.
Can I answer, please?
Yes, please go ahead.
I would say I feel like in this page, they just grouped most of the things that people fall prey into. So trading platforms, investing, crypto, I feel, yeah, a lot of people have been victims of that.
Okay. So how is the scheme like? Or how do they go about the scam?
So
Anybody has any
I'm
ideas?
thinking the back the back of the pig, the biggest side, I feel it's what most people have. I feel like the bigger the size, the more people
Mhm.
get. So that's what I'm seeing.
Okay. So great. Bright, please go ahead. Yeah, you are muted, Bright, if you're trying to speak.
I heard it's the way scam and scam victims through text messages or through social media messaging apps, or maybe through the WhatsApp also,
Yes,
like
true.
whereby they fake their profiles
Hmm?
and then
Yeah,
photos, and then
true. Yeah.
sometimes in a romantic relationship, like
Mhm.
they befriend you and then they scam you through that relationship.
Yes, right on the money. Right. So most of
I don't
these scams, yes, go ahead. Anybody else wanted to give it a
okay.
shot?
I was going to
Yeah,
say,
Kenneth, go ahead.
is it like a type of social engineering?
Yes. Yes, so it's a type of social engineering. So for the different scams that we know, right? Now the scammers have kind of categorized uh, a list of these little scams, and they generally call it pig butchering scam. So this type of scam, obviously, they are just taking you to the slaughters, right? So what they do is a whole variety of scams. So they might start with sending you a random test on your phone or on a WhatsApp. They might It might be a normal phishing email. So mostly they will start with like the phone, right? They will send you a text. Hey, we are supposed to meet here, or something on those lines, or like the delivery guy is at your door, or whatever you ordered, like the delivery tracking number is this. So click on this. And so they lead you on where eventually they establish some form of relationship. So if you reach out, they might probably say, no, it was wrong. It wasn't meant for you. But okay, so what's your name? Try to strike some acquaintance with you. And if you fall for that, right, then they will lead you into other things. So mostly what has really been working in this pig butchering scam is the crypto, like they use crypto, right? They have a crypto trading platform set up, and they will let you know, hey, I've invested in this. You can start small, right? Start with like $50 and see what happens. Now there are a lot of scams, like scammers around. So, and if you go to the website, it looks legit. Everything is on point. Then you're going to invest probably $50, right? The next day you see your investment growing. A month you see it growing. But all that you're seeing is just, digital money, or just, computer money, right? So you see your 50 has turned into 200, and you think, oh yeah, this thing is really, and then you are going to put in more until finally the trading platform just disappears, and there goes your money, right? So they do this a lot. Sometimes they use dating apps, like a whole host of investments, schemes. And so it's the little scams that are out there. They've now, grouped it into whereby once they get your contact and they strike some acquaintance, they have a like different variety, 100 different ways that they can go with this, right? So in the news this week, the district attorney for Brooklyn, right? They took down almost like 20 websites that are perpetrating such scams, right? So there were trading platforms and other dating sites and other, sites like that. And these sites, they were being run by these scammers. And so far, victims just in Brooklyn, in New York, they've been scammed out of $5 million from such schemes, right? And predominantly just in the crypto space, to invest. They've been convinced to invest in the cryptocurrency, and it ended up to be some, scam. So they are either going to reach out through WhatsApp, text message, dating apps, and the rest. So just be on the lookout. Any unsolicited text message, email, WhatsApp message, don't just play along, right? Don't think it's probably like a lost friend or a friend that you've been out of touch for a while. It is none of that. If it is a friend, you know it's a friend. So if you play along, that is where they end up with this. And if you are, because people think now crypto, if you're able to invest in crypto, you're going to make some good returns. So they are also preying on that. So if they strike that acquaintance, you trust them to a certain point, and they will show you, some crypto platform. Once you put your money in there, that's it, right? So this is the only cyber news that we're going to look at for tonight. Anybody else has anything on these lines or any experience on these lines? Go ahead, Brian.
Yes.
I have one example. They normally send me like your postal delivery has arrived at the warehouse. Something like that is related to what you're talking about too.
Yes, true, true. Yes. Whichever, please go ahead.
I have a good experience in this because it just happened to me of recent, but I didn't fall into the problem. The other way
Okay.
around, they can be able to come on this place. They will tell you that you got a job. They will want you to be writing the contest, try to publish the company, like a butcher company. They wrote me, and they said that I will be the one writing the contest and everything publishing it. So they will be paying me like $4,000. Then I'll be earning like 5% of any sales they make. So I was like, I flew along with them because I know it's a scam. I just want to know where it's going to end.
Okay.
So the other day, they come up with some free tools that I should click. I said, no, I will not click it. They should do it in PDF. so that I can be able to go through it. So I can't register anything online here. So they say that they will buy the material for the publications and the banner and every other things. So they will send me money. They will send me a check. Then I will go deposit the check in the bank. Once I cash the check, then I will send the money to the account they will give me. I said, really? So they say yes. So once I do that, then they will buy all the banners and everything, the flyers, so that I can be able to write the contest. I will be writing the contest. I was waiting for them. So one day I saw a check on their name. So when I got the check, I look at that check. I said, no. If I deposit this check in the bank, they were now persuading me to send the money. So when the check cash out, so that they can be able to get the material for me. I said no. So what I came back, I told them that I have went to the bank, and the bank said this is a scam. Since that day, they didn't write me again.
Oh, wow. Okay, great experience. So those tricks, like what they do is obviously the check is fake, right? If you go to cash it, if the check goes through, mostly it takes like 3 days for the check to clear on the bank side.
Oh.
So mostly, you know how when you deposit a check, they will just advance you some of the money. So when they
Yes.
advance the money and you send it to them, now the check is going to bounce. And then if probably they advance maybe $1,000, $2,000, and you sent it to them, then now you are in the hole for $2,000. Right.
Yes.
And if you are
Yes.
not careful, like the bank might also take you on and report you to the police because you are coming there with a fake check.
Yes. Yes.
Yeah. So those, if you are, and especially now, like the scams, there is a lot of scams going on in the job search area as well. A lot. So
And they were butcher. The company was a butcher company like that. I still have the company. It was a butcher company, meat company.
Oh, okay. Okay. So if you're applying for cybersecurity jobs or any job and they are asking you for your passport for without even you going through interviews and passing, and if they are doing in processing, I get it. You went through, you passed everything, you did at least 2, 3, 4 interviews, and they are doing in processing. Yes, they will need your social security and the rest, but just first initial contact, hey, send us your passport and all these details for us to confirm. No, all those don't really, and then sometimes they will, kind of do the same thing that Uchepa was talking about. Okay, so you are going to be in charge of 4 people. We will send you the check. When you cash it, you pay those people, and all that is just, I mean, you will know, you will feel that there is something really fishy about this one, because everybody on here has applied for a job. You've gotten a job, you've worked before, you know the process. You don't have to go through some cycles and going back and forth. And we are sending you a check for you to send us the money to purchase stuff for you. And and sometimes they will even have you purchase. So they will tell you are going to. They're giving you like a contract. They will have you purchase your own laptop and your own phone that you're going to use for work, right? And they are going to reimburse you eventually. So sometimes for the scammers who are a bit smarter, they will send you a good check for maybe $1,000 for whatever cost. And then after that, you've established some goodwill and some trust. So when they tell you to go buy an Apple, maybe iPhone 15 Pro Max, buy like a Mac machine with these specs, and when you buy it, they will tell you to send it to them for them to put the company software and mobile device manager on it and all that, and they'll send it back to you. Now, when you send all those devices to them, that is the end. Right? They just paid $1,000 for equipment worth probably 10,000. So be on the lookout for that also as well. Jamal, please go ahead.
Hi, Dr. Do. Here's just 2 pieces to a scam. A scam cannot work unless you're greedy. The second thing is you should never have to pay for anything. That's just simple. I'm from Chicago, so I learned this at a very early age. I bought enough Fool's Gold. So those are the basics.
All right. Thank you, Jamal, for that. So this is an example of some of the text messages that you're going to receive, right? So if you just receive any unsolicited random text messages, just totally ignore it, right? Just delete it. Don't click on anything. Just go ahead and delete it. Now we are going to jump into tonight's topic, that is HIPAA, right? So for our health folks who are on here, can anybody give us a rundown on HIPAA and why do we really have to stay in compliance with HIPAA and how is HIPAA helping us in the health space? Maybe 2 or 3 hands and then we are going to move on. Any folks in the health space? Go ahead, Uchiba. You are muted if you're trying to speak.
Yeah, the HIPAA, they helps a lot to protect the privacy and the security of a patient's sensitive information, health information.
Okay, thank you. Rainy, please go ahead.
It's a federal law. It's a federal law, and it like he said, it is to protect the information so that you will not be sharing or providing any data as far as health records to anyone.
Oh, okay. Thank you. Eliko, please go ahead. And then Olu Bami will go.
Yeah, so apart from what they've said, there's also regulations on if you have been breached, how to inform the affected individuals. And then also, the procedures for investigating any breaches, as well as just assuring the patients that their information is assured of privacy, that not just anybody without need to know would have to access their information.
Okay, thank you, Eliko. Olu, please go ahead.
Thank you, Dr. The HIPAA, my understanding of HIPAA is a federal law that was created as a national standards to protect the confidentiality and privacy of patient information. And when the patient data is breached, there's something we call breach or notification breach, something that you need to let them know that something has happened to their information. It's part of HIPAA law. So, and it's majorly protect the sensitivity of patient information from being disclosed to an unauthorized person without the patient's consent. So before you tell anybody about patient information, you have to make sure the patient consent to it and sign a form that you can share my data with this person. So that's all I know about HIPAA. Thank you.
Thank you. Thank you. Eric, please go ahead.
Yeah, basically HIPAA is a law that has been put there to help the patient, to give the patient assurance that all your information is safe with the health sector. So it gives you the patient the assurance that any information you put there, or if all the information they have from you, be it diagnosis and everything, is in the safe hands.
Okay, thank you, Eric. So what everyone said is right, in line with what HIPAA represents and what it is supposed to do. So the Health Insurance Portability and Accountability Act, HIPAA, we are going to look at the history of HIPAA and then we'll move into other areas of HIPAA, right? For us security folks, mostly our focus is on how do we assess a company against HIPAA, or who has to stay in compliance with HIPAA? How do we conduct an assessment, right? But how and why HIPAA? Why did it even came? Like what was the thought process behind coming up with HIPAA, right? So HIPAA, like I think Olu rightly said, it is an act, is a law, United States law. HIPAA pertains only to the United States, right? So for everybody who plays within the health industry, they have to abide by HIPAA. And this is a cybersecurity law for everybody in the health industry. So if you're in the health space and you want to branch into cybersecurity and you are thinking, but I have no experience in cybersecurity, you already do. You have been exposed to HIPAA. And if you go to school, all types of schools, if you want to become a nurse, doctor, insurance broker for the health side, all that, they will take you through some HIPAA training. right? So, whether you are IT savvy or not, you have some cybersecurity background going on, right? So for HIPAA, it was enacted in 1996. And we'll look at prior to HIPAA. Prior to HIPAA, there was nothing, right? In the cybersecurity space, we focus specifically on the protection of data and systems, right? So systems that are holding our data and the people and the processes that we use for the protection, right? So our focus, we are just going to limit ourselves to, the whatever data that we have, and then also for the systems that we are using in this space. Around 1996, right before the 90s, when we were transmitting health information, it wasn't as we have it today, right? Today is easy. You go to hospital 1, hospital 2, you go there, they don't even have to do anything. They have one big network. They can easily pull all your information, on there. Very easy. Now, just, imagine in the 80s, that wasn't the case. They probably had to, literally take the physical copies to wherever you are going, or you have to go and request for it, and they'll give you the physical copies, right? How patient information was being handled, every company was doing their own thing, right? And in the cyberspace, how we handle data should be well organized. It should be standardized, right? So when Congress and all the lawmakers in the states, when they realized that technology was developing and electronic transfer of health information was on the rise, and it was eventually going to be the norm of the day, they decided to come up with a way of protecting health information and all things related to health information, right? So that was the idea behind HIPAA, why they came up with HIPAA, and then also the different aspects of HIPAA. It also covers law, taxes, and all that. So not just the security aspect, but the security aspect plays for us as cybersecurity folks. Our main focus mostly is on the cybersecurity or information security aspect of HIPAA, right? So this is the idea behind HIPAA, how we protect our personal health information, which is a subset of personal identifiable information, PII. The protection of it is what HIPAA focuses predominantly on. So enacted in 96, and the goal for HIPAA was to make healthcare delivery more efficient. So, i.e., the transfer of information from point A to point B, and then also increase the number of Americans with health insurance. So, like I was saying, it wasn't just for the cyber security side or the information security side. So there's a lot more that goes into HIPAA, right? Now, there were 3 main objectives. They call it the 3 main divisions of this act that went through Congress, obviously, and then to the Senate. The first one is the portability provisions, and then the tax provisions, so the tax aspect of it that I was talking about, and administrative simplification provisions, right? So how this really plays along or how it comes to play for us as security folks, our focus is going to be on the third one, that is on the administrative simplification provisions, right? The tax aspect, that will be for the financial folks. So what was really the purpose? We kind of talked about the goal and, really the reason behind it. Now, the purpose of HIPAA, focusing specifically on the third provision, was to simplify a lot of stuff, most especially how we go about transmitting health information. So electronic transmission of health information, right? The main concern was that it was expanding in terms of technology that we're using to transfer and all that. So there had to be some regulation on it. Now, the irony of this is, around 96 is when the United States decided to protect health information. What about all other information, right? Up to date, we don't have any data privacy information for all other types of information. It's just the health information, right? So GDPR, we could have, around same 96, thereabout coming, we could have come up with something on the lines of GDPR, but still up to 2024, there is nothing, right? So we move on. Now, the primary purpose of this was to standardize the transmission of electronic health information. So Congress and everybody else who was involved, that was the focus. And then also Congress came up with another twist, right? Health information is also used a lot in research, health research. So how health, if we make it too stringent, then how are we going to use health information for research, right? So there's also the research twist to this also as well. We're not going to focus on that because we are not looking at academia's aspect of research, right? For us, we are just laser focused on information security. So Congress passed this, bearing in mind that they were looking at the privacy of health information, and then also because of technological advancement, the danger of just leaving everybody to do anything and everything that they want, right? So and then so once HIPAA was passed, it became it became a national standard of how, or like a standard for us to really standardize. So standard for us to standardize the electronic health transmission. So transmission of electronic transmission of health information, right? Now we are going to look at different aspects of HIPAA, right? All the way down to penalties if you don't stay in compliance with HIPAA. Go ahead, Eric. You are muted. If you want, you are speaking. Or if that was from previous, I'm just going to lower your hands down. Whichever, go ahead. Oh, that would, okay. That is also from previous. Okay, so pre-HIPAA era, what did we have? Like I said earlier, nothing really. Everybody was doing whatever they wanted, right? So no universal standard for health information handling, and then also electronic health transmission. And around the world, the United States is the only country with such, I stand to be corrected, with, an act like HIPAA, a cybersecurity act like HIPAA. I think I stand to be correct. I vaguely remember, I think I've seen somewhere in Asia, I think either Japan or one of those countries, they also have something similar. They just came up with something similar. That kind of mimics what HIPAA is doing. But United States came up with this first, right? And this is the only standard, popular standard, so far as I know, that deals with simply health information, right? So prior to HIPAA, there was really nothing. Everybody was doing whatever they want. And can you imagine if there is no HIPAA today? But this is going to be a big mess, right, in the health space in terms of how they protect data. So for HIPAA, there are several key components of HIPAA. Now we are going to look at, there are 5 main components actually. The first aspect of the HIPAA Act is the healthcare access, portability, and renewability, right? So this focuses on how to protect, or it helps us to protect health insurance coverage for workers and their families, and when they change or they lose their jobs. So this aspect of HIPAA focuses on well-being and kind of more on the human resources aspect of the house. It doesn't really focus much on security, right? Now, Title II, we are looking at preventing healthcare fraud and abuse, administrative simplification, and medical liability reform. So this also looks at establishment of national standards for electronic health transfer, and then also national identifiers for providers, health insurance plan, and also employers. So the system that we use in the health side, we are easily able to, all companies who are working in the health side, they are all labeled, right? And that came from Title II, right? So you can easily, the company name and then whatever serial number or whatever label that they give them is also in there. So this was also informed by Title II. Right now, Title III focuses on the tax aspect of it. So HIPAA, tax-related health provision, and this kind of lays out the groundwork for any tax-related provisions and guidelines for medical care. Right. So we move on into 5. That focuses on the application and enforcement of group health plan requirements. And this also is kind of tied into Title I. Now we have Title V, that is revenue offset. So Title V includes provision on company-owned life insurance and then also treatment of those who lose their U.S. citizenship for tax income purposes, right? So HIPAA, very comprehensive, focusing on, like we saw from the beginning, the 2 main goals: to protect health information and also to make healthcare affordable and open to all within the United States, right? Now, there are some HIPAA rules, right? We are going to look at 4 of them. So we have the privacy rule, we have the security rule, we have the enforcement rule, and the breach notification rule. So I think when we were given the floor and everybody was giving their take on HIPAA, somebody mentioned the breach notification rule, that if you are, I think Eliku. So if you experience a breach as a company, you have that obligation to notify your customers, and then also it depends on the magnitude of it. You have to also notify law enforcement and all that. So we are going to look at the different types of HIPAA rules that are out there. So the first one is the privacy rule. So the privacy rule was developed to help protect the privacy of our PHI, right? So personally identifiable health information. So how do we protect personally identifiable information? So we are protecting the information itself, and we are protecting systems that are used to handle this information. We are protecting the processes and the people that come in contact with this information, right? So the goal of the privacy rule is to prevent disclosure, prevent any unauthorized changes to this type of data, and then also ensure that this data is continuously available, right? So the primary target is to look at information use and then also transactions, and need to know basis. Only people who need to have this information will have this information. And then also customers or patients, not customers, patients in the health side, patients have that ability to control their information, right? So they have to give you that permission if you want to share the information or if you want to use the information for anything else, right? And we have, so still for the privacy, still this is just more on everything that we talked about on the privacy side. And for the security rule focuses specifically on information security aspect of HIPAA, right? It is about the protection of data and everything else that comes with it. But the security rule focuses predominantly on cybersecurity, information security. The goal here is to enforce confidentiality, integrity, and availability of the electronic transmission of health information and the health information itself, the protection of the health information. So, in cybersecurity, our main focus is to help reduce risks. And how do we reduce risks? If our confidentiality is compromised, risk has occurred, integrity has been compromised, risk has occurred, availability has been compromised, risk has occurred. So our goal is to enforce confidentiality, integrity, and availability, right? Looking at it from the perspective of people, processes, and technology. So that is what the security rule is focusing on. And mostly when we are doing HIPAA assessments or HIPAA audits, the focus most often is on the security rule aspect of it, right? So how are they protecting their data? How are they protecting data moving from point A to point B? And we are going to look at a checklist of how you'll be able to protect your company against HIPAA. And hopefully, if no other topic, I think we have another topic for next week. But if that doesn't cross the path, we will look at some use cases of how to conduct an audit using how to conduct an audit within the HIPAA space, right? So focusing more on security. Today is more of our general exposure to HIPAA. We know what HIPAA is about, but then, we want to dive a bit more deep into just what we know, right? So that is the security rule. Now with the enforcement rule, simply the meaning is in the name, right? If you don't stay in compliance with HIPAA, who is going to enforce penalties and the rest, or any punitive action so this speaks to the enforcement rule. So the enforcement rule outlines the penalties that will be issued, who has to issue these penalties. So the Department of Health and HHS is Health and I don't remember the other name, but they are the Department of Health Services.
Health and
Human Services.
And Human Services. Thank you. Health and Human Services. So they are the ones who established HIPAA, right? It was through them, and obviously Congress and everybody else will pass it as an act or as a law. And we have the civil rights aspect of HHS, and they are the ones who enforce any HIPAA violations, right? Sometimes they can even conduct, HHS can have OCR conduct HIPAA assessment or HIPAA audit or HIPAA forensics on your company if they suspect any violations, right? So we will get into the space of who can conduct an audit and all that, but we can simply answer that and move on. So when you are conducting your normal HIPAA assessment, it doesn't necessarily has to be HHS. We have different organizations that can do it. There is, unlike PCI and others, there is really nobody that is going to train you and certify you as a HIPAA assessor, right? Any company that is a cybersecurity company that knows what they are doing and are very familiar with HIPAA can do an assessment on your company for HIPAA, right? But the only time where, the government agency will come in is where, like, lack of better words, in a funny way, you don't mess up, right? So if your company is doing really poorly, then they will come and do kind of like a legal investigation or forensics on you. So the enforcement rule kind of gives everything that will happen if there is a violation, what needs to happen and who has to enforce what, right? And what type of penalties that you can get for not staying in compliance with HIPAA. We'll look at the penalties also as well as we move on. And then we are going to look at the last rule, that is the breach notification rule. So if your company has been breached and the breach happens to, HIPAA, PHI or health information from your customers happen to be part of it, or if it is PHI breach, you have an obligation. This rule tells you exactly what you are supposed to do, right? And the key components of this rule is to notify individuals whose health information has been breached or compromised without unreasonable delay, right? So if there is a breach, that is not a time for us to sit there and, scratch our head and should we tell them or not, right? You don't have that luxury. You have to tell them or send out like something, publication notification to them as soon as applicable, right? So because we are going to look at some of the penalties for not doing that. And, if you're a company owner or you play within the health side, you don't want to mess with this. So also notification of the Secretary of HHS of the breach of PHI, right? And in certain circumstances, you have to notify the media, and then also in certain circumstances, you have to notify the security agencies, right? So maybe police within your state or within your community, for them to also, so law enforcement to also have to come in, right? So this breach notification rule helps us to stay on the right side of HIPAA. Now, when HIPAA was enacted in 1996, there's been a couple of improvements and enhancements, right? Updates and enhancements. We are going to look at some of them, right? One is HITEC, right? So HITEC was also enacted in 2009. It is supposed to be an improvement on HIPAA or an addition to HIPAA or an update to HIPAA, right? This act, the main goal was to looking at health, electronic health records and how we can strengthen the HIPAA rules in terms of privacy and security, right? So reason why there are these updates is that technology is not static. Technology is continuously developing. So we have to always revisit what we have and make sure it is relevant to the times that it is in, right? And then the next one is the omnibus that was also passed in 2013 and still looking to expand more on the business dealings. So this looks directly at the liability of business associates, right? And penalties for non-compliance when it comes to business associates as well. Now we are going to look at who a business associate is under HIPAA. So before we move on, our entry-level course, if you are looking to get into cybersecurity, break into cybersecurity, get into our entry-level course. 4 to 5 months, you do 2 months of internship as well, hands-on training where you work with cybersecurity tools, and then we are going to build your cybersecurity knowledge from scratch, right? So look, if you are looking to get into cybersecurity, break into cybersecurity, the cybersecurity entry-level course, and then also if you're already in IT or you have some IT cybersecurity background, you can jump into a niche, arguably the most lucrative niche within the cybersecurity space, that is PCI or the payment card industry. So our next cohort was supposed to start, I think, this week, but that has been moved to the right. So April cohort, the date was still going to be put out. But if you are looking to get into PCI, specialize in PCI, become the PCI god in whichever company you find yourself, then we have the best PCI training out there so far. And then also for our GRC internship, our next cohort is going to be on the 18th of May. So GRC internship, we work with 2 of our sister companies. We go over 10 major security projects within the GRC space and more, right? And this is your first, or this is going to be your working experience in the cybersecurity space. If you are going to interviews, you are speaking to some things that you've done, not things that you just read, or just with like certifications that you have. But employers are looking for what you can do, not just what you know, right? So your first working experience in the cyberspace, this is it right here, right? Real world cybersecurity experience. So all of this you can get on our website. If you go to Eretmis Academy, you'll be able to register and enroll in these different programs. And our WhatsApp group, I noticed somebody was asking how to join. We are going to post the link in there shortly after we go through the presentation, and then also agenda 1 million subscribers by October 2024 for Eretmis Cybersecurity YouTube channel, right? We are at 592. Hopefully by next week, we'll be around 600 and something. So kindly support, help us reach our goal, because we are also helping spread the knowledge and the skills and spreading the word about cybersecurity to our communities, right? So we are jumping back into HIPAA. Who has to stay in compliance with HIPAA? Right? We know hospitals, everybody in the health space, but what really is the breakdown, right, when it comes to who has to stay in compliance with HIPAA? So when HIPAA was made when it was enacted in 1996, they had some people in mind or some entities in mind whom this was going to touch, right? Now, with introduction of the Omnibus 2013, there's been some improvements on who has to really stay in compliance with this. So there are 2 main entities that have to stay in compliance with HIPAA. We have what we call the covered entities and the business associates. So who are the covered entities? Who are the business associates? We are going to look at them here shortly. So covered entities, they are the main group or main groups of entities that have to comply with HIPAA or all the HIPAA rules. And we looked at all the HIPAA rules, right? So these entities include, but not limited to, healthcare providers. So healthcare providers being hospitals, clinics, doctors, psychologists, chiropractors, nurses, nursing homes, name it, right? Pharmacists, dentists, everybody within the health space working within the hospital or clinic setting, they all have to stay in compliance with HIPAA. So the company itself and the individuals, they have to stay in compliance with HIPAA, right? Now we move into the next category, that is the health plan. So health plans, that covers the health insurance aspect of the whole health industry, health maintenance organizations, your HMOs, and company health plans, government or state health programs like Medicaid, Medicare, veteran, and military health programs. All of that falls under. So if you work in the health insurance space or in any of these areas, you individuals have to stay in compliance. The entities and companies will also have to stay in compliance as well, right? Now, healthcare clearinghouses. So these entities, they are not necessarily directly touching, health information, but they are touching it indirectly in some other way, right? So companies that are, doing taxes, that are doing accounting services for health information, health for companies within the health space, they are also considered to, they are also liable to stay in compliance with HIPAA, right? But for these companies, they process non-standard health information that they receive, put it into a format, so electronic format or data content, and vice versa. They all have to stay in compliance with HIPAA, right? So billing services and, companies that are processing your card data and other information like that, they all have to stay in compliance with HIPAA as well. Now we move into the business associates. Who is a business associate under HIPAA? So business associates, it can be a person, it can be an entity or a company. If they perform any functions or activities that are involved in the use and the disclosure of protected health information on behalf of, covered entities, then they have to also stay in compliance with HIPAA. They are classified under the business associates, right? So consultants, billing companies, IT providers, attorneys, accountants, they are all going to fall under this space, right? So, and caveat to this is they have to come in contact with, or they have to, or they need to have access to PHI, that is your health information, for the kind of services that they're providing. So if there's an accountant who has nothing to do with your health information that your company is handling, then they don't really have to stay in compliance with HIPAA, right? They are not directly classified as business associates. They are business associates in the sense of business associates, but under HIPAA, they are not liable to stay in compliance because they don't come in contact with PHI, right? So same with attorneys, same with IT providers. But if they do come in contact with PHI, then they have to also stay in compliance with HIPAA, right? So what information is protected under HIPAA? We talked about that extensively. So health information systems that are used to house or process this information, they are all what has to be protected under HIPAA. So your personal identifiable health information, how we move it, how we store it, how we process it is what we are referring to. And then also for the handling of it, whether it is electronic on a paper or whether it's oral. So I can just call you and ask you, hey, my mom is at the hospital. If you're at a reception or you're a nurse, I just randomly come up to you. My mom is being admitted here. I need to know her status, right? What is going on with her? What is her condition? They can't just give you that information, right? So at least they have to see that you are either the guardian or you are the next of kin or you are somebody related before they can disclose, or you're in charge of your mom or whoever your family member is before they can disclose such information. So orally, they cannot tell you over the phone. They cannot tell you even in person unless they see something that qualifies you for you to be able to hear that. Same thing digitally, they cannot just send it to anybody without the proper measures in place. And, in terms of like paper-wise, they cannot just leave your health information lying around just like that. So that is why, even if you have like health folders, it is being filed in a cabinet, it's being locked, and it's being protected. So we don't just leave it in an open cabinet in an open space in a public area that anybody can have access to, right? So the type of data, although we are looking at just personal health information, we can find this information in different categories, right? So orally, digitally, or in the paper form. So when it comes to going forward now, PHA includes the following, right? So what is considered to be part of your personal health information? So the patient's name, the address, birthday, right? Social security, biometric identifiers, and other personal identifiable information. So other PII will all be considered under your personal health information. Now, your past history, so your past, present, or physical or future physical or mental health condition is also part of your personal health information. Any care provided to you as an individual is also part of it. Information concerning your past, present, future payments for care provided to the individual that identifies the patient, or information for which there is a reasonable basis to believe could be used to identify the patient, are all considered to be part of your personal health information, right? Now, what is not considered to be part of your personal health information? That is also very important, right? So employment records, if you're a nurse at hospital A, your records, employment records, and what you did and the roles you were holding there, that doesn't qualify as your personal health information, right? Your educational information doesn't qualify to be part of your personal health information, right? Now, the identified data, which is data that cannot be used to identify you, cannot also be considered to be part of your personal health information. In some quarters, they even refer to, so some of the information that cannot be used to directly identify you, even though we might consider them to be health information, they are not. So, for example, maybe if you go to the hospital, your blood work results, right? If your name is not tagged to it, just the results, it can be for anybody. Your blood pressure, if your name is not attached to it, it can be for anybody, right? So that type of information cannot really be used to identify you. So if it is just written on a piece of paper without any name to identify you, then that is not considered to be personal health information, right? But if it is, it has your name on it and everything, then obviously it becomes personal health information, right? So it's good for us to know what is included and what is not included. So we are looking at some of the penalties. If you don't stay in compliance with HIPAA, what is really going to happen? Do we really have to stay in compliance with HIPAA? And do we have the choice of, we feel like staying in compliance today, or we feel like not staying in compliance? This is a law. HIPAA is a law. HIPAA is the only, so I wouldn't say, yes, HIPAA is the only framework that applies to everybody outside, even outside the government space. That is a law. That is backed by a law, right? Everything else in terms of other frameworks like RMF, FESMA, FEPA, and the rest, they are specifically for the federal and government agencies, right? So even if they are backed by a law, it's for the government and the agencies under the government. So it doesn't apply to the corporate side of the house, right? But HIPAA applies to corporates, to the government, to anybody and everybody within the health space, right? If you're a covered entity or you are a business associate. So we don't have that luxury of saying we might choose to stay in compliance or not, right? So HIPAA is a big deal, very big deal. So what are some of the penalties? So HIPAA privacy rule penalties. Under HIPAA, if you don't stay in compliance, there are a lot of penalties that can occur, right? And these penalties have been split into 4 main categories, and we are going to look at these 4 main categories. And we looked at who can enforce these penalties, or who is responsible for enforcing these penalties under the HIPAA enforcement rule, right? So these penalties under 4 main categories, we are looking at, I'm going to go through these, word by word. So 1, if unknowingly your company violates HIPAA, the penalty can be $100 per violation, with an annual maximum of $25,000 per repeated violations. 2, if your company reasonably causes violation of HIPAA, then it's $1,000 per violation and an annual maximum of $100,000 per repeated violation. 3, if your company willfully neglects HIPAA, right? The violation is corrected within a given time period, then you pay, $10,000 per violation, with an annual of $250 per repeat violations. And the last one, if your company willfully neglects HIPAA and you don't also do anything to correct that neglect, then you are subject to $50,000 per violation, with an annual maximum of 1.5 per repeat violation. And I don't think all companies are all companies are set up to make money, right? To make money to pay their staff, and if it's a for profit, to make money for the investors and the owners, right? So you don't want to be paying these amounts just simply because you couldn't stay in compliance with HIPAA, right? Now, let's look at some other serious aspects of this, right? So for covered entities and individuals who intentionally obtain or disclose personal health information of patients in violation of HIPAA or in violation of a HIPAA privacy law, can be fined up to $50,000 and receive up to a 1-year jail sentence. So a prison term of 1 year. So HIPAA is no joke, right? For other frameworks, if you don't stay in compliance, you can't go to jail for it. Probably you get fined here and there. HIPAA, there's also jail time associated with this. So that shows the magnitude and the seriousness that the government is putting behind this. Now, the last one we will look at in terms of the penalties, if the HIPAA privacy rule is violated under false pretense, right? If you are just trying to come up with some BS and you are pretending and you are violating it, under false pretext, then the penalty can be increased to 100,000 per fine, and then also up to 10 years in prison, right? So you are in business in the health industry to make money, not to go to jail. And so if you're in the health side, you might want to take this more seriously, right? So these are the penalties associated with violating HIPAA, right? And this is set in stone, is law. So really you cannot go around it. You just have to make sure you are staying in compliance with HIPAA. So how do you stay in compliance with HIPAA? Now, this is a checklist that we're going to go through in terms of how we can stay in compliance with HIPAA. So 1, for your company, and we are looking at it from a company perspective, right? So we have to, as a company, you have to establish a HIPAA compliance committee. And I will start with a HIPAA compliance program, right? Not just a committee first. Program, and then you have members who are going to be the HIPAA compliance committee. You are going to review. So as part of the program, you are going to come up with your policies, HIPAA policy for the company, a HIPAA charter for the company as well, right? And then your SOPs that are going to follow, and then all other policies that you are going to need under security for HIPAA, right? And then we'll look at the review. You are going to do a review of HIPAA guidelines as stated, in the HIPAA law. You are going to perform gap analysis to identify any areas of concern. So you can't do gap analysis if you don't do an internal assessment, right? So you do an internal assessment with HIPAA, and then you identify gaps. You analyze those gaps, you come up with the dates and timelines of how you are going to fix. So gaps here, they are simply any item that you are not in compliance with, right? Any control you are not in compliance with is classified as a gap, right? So you need to close those gaps before your main assessment is due. Now you build and you execute a plan to address these gaps. That is like what I just spoke to. You review, like you do a review of the key vendors' interactions with PHI. So this falls under your third-party risk management and review, like doing a review of your third parties who are interacting or who will have access to your health information of your patients. You have to constantly do a review on them using your third-party instruments that you have in your company, and then perform an ongoing monitoring and audits. So within your company, it is encouraged for you to do at least every quarter, do an internal assessment, identify gaps, fix them, and continuously monitor, right? And then establish a data breach incident response protocols. So not just establishing the data breach incident response, but actually making sure you have an incident response program in place. And in our internship, we work on incident response. So interns get to develop program incident response program, set up incident response teams, go through tabletop exercises. So all these are things that you have to do within your company. And here specifically focusing on your tabletop exercises will focus on HIPAA, right? And then most importantly, you perform HIPAA training. So HIPAA training will be part of your security awareness training for your company. And this is very important because people, processes, technology, people always have the big question mark, right? Because people can make or unmake your compliance with HIPAA. So we have to focus on the people side. We train people. And, you know, in the health side, everybody in there, not necessarily IT savvy. You know, some people know more IT, but they give themselves less credit, right? So we have to constantly let this be in their face. This is what we need to do. This is what you cannot do, right? So, and I think in the health industry, they are doing a good job at this point in terms of the education side and the training. For hospitals, they constantly do this HIPAA training. For schools who are training health professionals, they'll take you through HIPAA wherever you go to your school. And we have to, on a regular basis, evaluate our compliance and review our HIPAA updates. So constantly, you can do your audits and do everything, but in security, you know, everything falls all the way down to monitoring, right? Constant monitoring. So you don't have to, you know, you have to always be testing your pulse. You don't have to take your hands or your fingers off your pulse. It has to always be on there to make sure that you are good. If you assume you checked it last week, so you are good, then you are in for trouble, right? Because if you get breached and the breach borders on HIPAA, then you have some issues with HHS, right? And then also add a subject matter expert for assistance. So on your team, on your security team, you have to have somebody who is a HIPAA expert, right? Who has really gotten some training in the HIPAA space, who is very familiar with everything HIPAA in terms of all the regulatory requirements for assessments within the HIPAA space, right? So with that, we are going to wrap up for tonight. And Mike, I'm going to give you the floor. Just hold one. So our cybersecurity WhatsApp group, we are going to post the link for our YouTube channel. We encourage everybody to look into it and support. For anyone trying to get into the cybersecurity space, Eretmis Cybersecurity Entry-Level course is the way to go. We spoke about that earlier. And this training, very comprehensive. It covers everything, including 2 months of internship. So this is going to be not just a foundation into security, because then the knowledge and skill you're going to gain it goes all the way up to intermediate level, right? So please look into that. And then also for our PCI DSS cohort, which was supposed to start on the 4th, we've pushed on the right. So there is still space and time for you to join, right? And then for our GRC internship, that we've started our first group already last 2 weeks. Our new cohort is going to start on the 18th. So please look into that also as well. And with that, we are going to wrap up for questions from the group. Go ahead, Brian. And then I think, yes, Brian. So somebody's hand was up, but they lowered it. Brian, please go ahead.
Can you hear me?
Yes.
Okay. Just to ask, what if with how paperwork, like employees can't leave stuff behind with people's names and things on it. So what if a patient, which I'm pretty sure has happened, they got the results and everything of any health conditions or prescriptions or something like that, and they had their paperwork with them, and they were in the lobby waiting for, let's just say, Uber, but then they left their paperwork behind. So let's just say an auditor or something like that, for some reason, came by and seen that. Would they still be in violation of that, or how would they go through the process of saying, okay, we didn't do that. That was the patient leaving their information there.
Okay, so if I get your question right, the patient left their information maybe in the waiting area.
Yes, correct.
Okay, so I mean, then that will be on the patient. That is not going to reflect on the company. Right. So if you're an auditor, you cannot hold them accountable because it's the patient. And ultimately, the patient is responsible for their information. Right. So if they choose to give it out or they are careless about it, then we cannot really fault the institution that gave them the information, which is their information in the first place. Right. But great question.
But what I was meaning is, how would they investigate that to know if an employee left it there or a patient left it there? That's what I meant.
Okay.
That's what I'm trying to get at.
Okay, so I think probably, obviously, if it's in the waiting room or in the general area, then it might probably be, just assuming, it might probably be a patient, right? And then also, how the professionals, the nurses and the doctors and the rest will keep your data will be different from how a patient will keep it. Probably, like if they give me one, I'll just roll it, right? And probably put it in my pocket or fold it into two or something on those lines. But, the professionals, they will file it. It will be like in a file, in a filing cabinet, or kind of in a professional way. Right? But great question, Brian. And like that can also come up. That is a very good scenario. So yes.
Dr. Du.
Go ahead, Andy.
Practically what it is based on how the healthcare keeps the information. So if, just like you said, if it's in the cabinet, file cabinet, that is not locked, or is left in the waste-based basket inside the work area, and it's not shredded or something, that is when they're going to be held accountable. Or if it's in their database and somehow it was hacked, they didn't give it the proper guidance or protection, and it got leaked. But if it's in a place where it's obviously not in their care, like in a patient's sitting area, then the investigation will show that they are not guarding it. If they, it goes on to say if the patient was there and a receipt was handed to him with this information on that, then they can be spared for not being responsible for keeping that. Just like in any financial in a financial institution or anything where information is kept.
Yes. So, I mean, if it's in the care of the entity or if it's in the care of the business associates, then they have that ultimate responsibility of making sure they keep it safe. Right. But once it's in the care of the patient, then the patient has the ultimate responsibility of keeping their own information safe. Right. So if it's within the entity, then they can always be held responsible if they don't handle it well. Right. Go ahead, Mike.
Good evening, Dr. Eddie.
Okay, good evening.
Okay, so I have a question and then something I want to share with everybody here. I mean, maybe it might strike a chord or something like that. So I was requesting an information from a company that files tax for, income taxes. Okay. So the information I was requesting shouldn't contain any personal information, like sensitive information like that. But I'm sorry. When this employee was sending the information to me through email, I saw that, my God, he had my company EIN on it. He had my name, my full name, my social security, my date of birth, my phone number. Yes, on this, and that was emailed to me. All I was asking for was some document which shouldn't require this. So my question is, would this be under the HIPAA? I think you said something about about taxes, right? Taxation. So probably would that be under there? And on the other hand, I would say the company is not training the employees properly as to handling sensitive information of their clients, because I mean everything about me is on this paper, and if somebody gets their hands on it, I think I'll be screwed up. So I intend to talk to whoever it is when I get into the office with them, and kind of like discuss it with them and in a nice way. So
Okay. So, do you work in the health space?
no.
Okay. So the tax aspect of what we're discussing under HIPAA, yes, it's limited to, everything within the health space. It doesn't go beyond, the health space. So if it's within the health space, then mostly, and even that is not like for personal taxes and the rest, is taxes associated with the entities themselves and how to go about it. So that is not really going to be, it doesn't fall under HIPAA. And two, I mean, sending your PII, over net or via email, sometimes you have to be a bit careful, but people don't know what they don't know, right? So I think I was trying to make a payment for one company, and they were like, okay, email us your card information. And I'm like, nope, not doing that. I can tell you over the phone, but I'm not going to email it. Right. And they were like, okay, sure. I mean, like the person that didn't mean any harm, but she just didn't know. Right. So sometimes if we know better, so we have to point people in the right direction. They don't mean any harm, but they just don't know what they don't know. All right. Dr. Middleton, please go ahead.
Hi, Dr. Adu. Kudos for always bringing forth content that is equipping the masses for employability. I want to say that I actually got my start back in 1999 with HIPAA and really the GRC space. I was a contractor helping Kaiser document their screens for their electronic health record system back then. And the help feature for the tool was actually online. So I was using a tool called RoboHelp. That's how long ago it was. And that eventually propelled me to Blue Cross as a HIPAA business analyst for their pharmacy benefits arm. So as it was a call center, and we were redesigning screens that the call center reps would see, and also updating the scripts that they would use to handle the calls. So that was back in 2001. So you think about the longevity and the opportunity to kind of grow in the space. And so now I'm in the GRC space, but I got my start in GRC with that HIPAA knowledge and exposure. So yeah.
Great
info.
Great. Thank you. Francis, please go ahead.
Yeah, good evening, Dr. Edu. I want to know if the information, like you were saying, when the professionals are handling information, they will handle it in a professional way. And maybe when they print out an information and give it to the patient, maybe the patient drops it, like how the guy said, maybe he's at the area waiting for a Uber or something, and he forgets his document and leave it. Fine, maybe assuming the person is a very sensitive person, or let me say, and keeping it in a nice way in a file or something, so he didn't mess up with the document and it's looking clean, everything or something. How do the audit or whoever, or the auditors you're saying, or whoever, distinguish that? And maybe in every system they knew, maybe they gave the patient a document. How would they know the patient left it intentional, like unintentionally, or it was somebody in the end institution who made a mistake? So how would the auditors, and how would, I just want to know how they're gonna distinguish between these two, and also come to a conclusion, or know that or it was the entity that does that, or it was the patient who made a mistake.
Dr. Du, can I say something to that?
Yes, please go ahead.
Okay, so that is why we have audits. And to the person that asked the first question, every institution, every organization has rules and regulations pertaining to how you manage client information. So HIPAA happens to be just for healthcare. So when it comes to a situation, a long process goes into effect to determine how it got there, where it came from. Questions will be asked, processes will be taken. And if it's something that is been violated and it's causing, it's not just anything, just like we found it there, so you are just, if it's something that could have caused a huge harm, a lot is put into it. So definitely, so many processes goes into effect, and they will know how it got there. So
yeah, that is what
Okay.
I'm asking.
Okay. So, Francis, let me help you
Yeah.
out here. I think I'm also going to answer your question. So, they found it in maybe outside the institution or in the waiting room. How do they know it's not the original copy that is being kept? Right. I mean,
No. I want to know, maybe if not even if it's not the original, I guess they can print it out, and maybe intending, maybe whoever intending or handling it to the patient made a mistake, maybe drop it somewhere, somebody took it, or the patient took it and also left it there. So in this case, thank you.
That will be at the discretion of whoever is doing the audit, right? If it is me doing the audit, I'll just double check with whichever maybe office is close by, and probably find out how did this end up here. They can let you know it was given to this patient who came today, so they can give you all that record of, okay, this person was checked in today, he left this time, we gave him this. And I mean, that will solve the problem, right? That really is not your biggest problem when you are doing an audit in terms of how they are keeping information. So if it is left somewhere that looks like it was a patient who left it there, then obviously you can just ask questions and you'll be able to find the right answers to it, right? But that ultimately depends on the discretion of whoever is doing the audit.
Yeah, because some patients can lie. Oh no, you never gave it to me. You never did, or something.
Yeah.
You get what I mean?
So when you are doing an audit, you're not going to talk to the patient. It's the entity that you're auditing. So patients don't even come in.
Oh, okay. That's all. Okay, I now understand. Okay,
All right.
thank you.
Francis. Go ahead, Andy.
And I should have put my hand down. I was trying to explain the other gentleman. I was trying to find out the first gentleman what his job was related to, because there are rules and regulations pertaining to every institution. So he should find out what his particular specific institution is and how the rules.
How they handle
Yes.
PII. Okay.
PI, yeah.
Okay. Thank you. Elico, please go ahead.
Yeah, I was gonna respond to the gentleman who was talking about the trying to follow up with their tax information. Actually, all people handling taxes are not right now authorized to transmit that kind of information via email. They
Okay.
have to, yeah, they can upload it to a portal, and then the person goes to the portal to download it. So that whoever gave you that information, you're right, they are violating some rules, and if it came to light, they would be in very big trouble.
Oh, okay. Thank you, Elico, for that insight. Rainy, please go ahead.
Hi, I was going to say I worked at John Hopkins Hospital, Blue Cross Blue Shield. I'm like the lady that came and said she was in I worked in 1990, 91, 92, 93,
Okay.
and I worked in the billing department, but I worked in
Great.
various different departments.
Mhm.
And the information that you're going to print out for the patient, it used to be a date stamp on it. So that would identify where it was printed at. They tell you where it was printed at, and also the medical record information, whether they got it from medical records or they got it from the actual medical center. So that's another thing. You have to know exactly where the patient may have gotten their information from, because there's so many different various entities that you can get printout from based on what they're going for and what procedures they're having. So, and
Oh,
then
okay.
they gotta sign off to receive that information. Just like you just don't give it to them. They got to sign off saying that I'm authorized and so on so to get this record.
Yes. Thank you. Thank you for that. I think that answers a lot of the questions that people had on here. Go ahead, Bright.
Yes, Dr. Edu. Can telemarketers obtain my PHI and use it to call me and sell goods or services to me?
So for PHI, not really sure. Maybe your PII, they might be able to find some of it. And some companies will sell your PII. Not I don't. So anybody within the health side, I mean, they are forbidden by HIPAA to engage. Just like disclosing for free is not even allowed. How much more even selling somebody's? That is way like you are going to jail for that, right? So if they do it and they are not caught, then when they get caught, they will get in big trouble. But for PII, sometimes they can even get some of your information online, right? And most like now is even easy. Most of us put our own information online, almost all of it, right? So if you go to somebody's Facebook, you can see their name, where they live. They have a list of their kids, their birthday is there, list of their birthday, like their kids' birthdays and the school that he went to or she went to. That all that can be put together to become your PII, right? So we have to be careful how we are just putting stuff out there that we think is like it is really nothing. Is like it's not going to hurt us, But all that information people can get for free online now. They don't even have to buy it. So for telemarketers, they have ways and means of getting that information. Sometimes they even get it for free, right? So for HIPAA, for hospitals, it is really forbidden to give your PHI to anybody, let alone to sell it, right? Go ahead, Brian.
Yes, this is my last question. We know that under HIPAA, it's their responsibility to protect data. So I just look at different scenarios. Is there any caveats in case a natural disaster happens, such as, let's just say, a tornado? They have everything locked up. A tornado hits, breaks everything apart, files fly all over the place throughout the city. They've lost a lot of data. So, is there any caveat to that? Because they did their best to protect that data, but because of a natural disaster, this is what's happened.
Yeah, so that is it is unintentional, right? So they're still going to suffer some. They are still going to suffer some fine, but it is not going to be as if they did that on purpose. If you did it on purpose, then you can go to jail for like 10 years thereabout. But they are still going to get fined. Just like how, we're minding our business and then Brian just decided to hack into our network, stole our health information. So please, have mercy. We didn't do anything wrong. It doesn't work that way. So although like tornadoes and like nature happens, but still, right? It was in your care. So I don't really know what you can do in terms of preparation to maybe don't set your office in a like tornado prone area or something on those lines. But yes, still like you're still gonna get fined. And for that, maybe probably a small fine just to make sure like the system is working. But like good example though, good example, right? So and then also I think reason why they can also hold hold your feet to the fire is things happen, incidents will happen. But if you have a very robust incident response team, they will be able to get this under control in less than no time. Right. So all these companies that will be in the news, they got braced and they are going back and forth. They don't know what to do. And, it takes them weeks because they don't have a very robust incident response team. If you do, they will be able to, act as swift as possible. So a very huge incident might look like it's really nothing. And for companies with, incident response programs that are pretending to be an incident response team that are pretending to be doing incident response, when something happens, a very small incident becomes, a huge mountain for them. Right. So, great question, Brian. So I think we're going to give some shout outs to everyone who joined, who has their locations in here, and then we are going to wrap up for tonight. So if there are any questions, you can please raise your virtual hand and bring it up also as well. So we're looking at Lord. Thank you. London is midnight there, about like 3 a.m. there. Sam, Cincinnati, Ohio, Sapon from NJ, Festus, California, Maryland, Ucheba. We have Andrew from Pittsfield, Rosie from Maryland. Maryland will be coming to Maryland. Hopefully, we will be holding our live event in Maryland. Right. Still fingers crossed. San Francisco, Shongo, San Francisco. Then we have Texas, Yanka from Texas, Michael, Vancouver, Canada, Nana from VA. And then we have Jason from Japan. Obviously, it's morning in Japan. Nikki from PA, Felix Deluxe. Fort Worth, Texas, and then Abena from Frederickson, Maryland, and then we have Sapon from NJ also as well, Daniel from California, Massachusetts, Jane, and the list goes on. Eliku from Illinois, Renee from VA, Ucheba from Frederickson, Old Bridge, Walt, Osai from San Francisco, Texas. Okay, thank you. So there used to be a lot of Texas. I think today, most of our Texas folks didn't show up. Still some Texas in here, right? Dr. Middleton from LA, and we have Brian, Texas. Okay, so I think the Texas were down here. Roland from London, T from NY, California, Stella, and the list goes on. I appreciate it. Atlanta, in there we have Texas again. Yes, so my Texas folks. Adrian from Nairobi. Adrian, I didn't know you moved back. I was thinking you were in Spain. Texas also, Ransford from Texas, and we had so I appreciate every Burlington, NY, NJ, Alex, Sabrina, Alaska. First time I've okay, Sabrina, I appreciate it. Alaska and North Carolina, Faisal, and Brian, Texas. Yes. So I think we're able to go through the whole entire list. Not everybody put theirs in there. So tonight, I think we're almost 100 in attendance, 90 something, 95. It keeps reducing, going back and forth. And then also on YouTube, there are some, folks on there yet to look at the YouTube numbers. I appreciate everybody's time. So we are wrapping up for tonight. Next week, hopefully, if, our schedule permits, we are going to go back to HIPAA. look at how to conduct HIPAA assessments, right? Gloria from Canada, I've also seen that. So how to conduct, actually go through for us as security professionals, our goal, how do we go about assessing a company against HIPAA, right? We'll look at how you'll be able to do that. And then also we'll look at a career in the space or specializing in the niche of HIPAA, right? And maybe probably Dr. Middleton can give us some tips here and there also as well, right? So HIPAA is like one of the areas that you can also specialize in the cyberspace, right? So I appreciate everybody's time. Have a great weekend, everyone. Like always, you could have been anywhere else, but you chose to be here to share in the knowledge, and hopefully you gain something out of this. And next week we're still going to continue with Cyber Chat. Keep learning, stay blessed, and have a wonderful weekend.
Thank you, Dr.
Thank you. Thanks,
Thank
Doc.